So questions come from the creative groups to the back office, and back office comes back with an answer, not the next day, not even the next, maybe the next hour. Innovation Race is actually a temporary innovation factory. I put together all kinds of people with different knowledge and experience. The goal is not to have many ideas. The goal is to have something that is useful, something that makes it better for people.
And we have 52 hours. It may sound much, but it's not. To go from idea to real concrete project that we can say yes or no to. Should we do them or should we not?
And we will start with a blank sheet, basically, and we call it problem mapping. That's the most important part of the race, trying to find the best and most interesting problems.
I mean, we're talking a lot about working together, but here we actually do it in a short period of time with the same goal, to find better treatment for patients.
We're able to leverage some of the global expertise and capabilities and a very innovative hospital like Uppsala University Hospital and put our brain power together, put our resources, global resources together with the best interest of helping patients improve outcome in cancer specifically.
I would summarize the biggest challenge for healthcare today and going forward in 2 words: collaboration and intelligence, with the patient at the center. And that is also the secret recipe for innovation. You have to collaborate not once in a while, but in your daily life. And that's what these 52 hours have been showing. They've been collaborating and asking themselves, what if we could collaborate this way with an innovative mindset for transformation every day, where that intelligence is always centered on what is the outcome that I want to achieve for the patient.
Okay, everyone, now it's 1 hour left and we really have to wrap this up. It's getting a little bit stressful here, so please make everything ready, put it in Teams and do the deliveries as soon as possible.
5, 4, 3, 1. What? Yeah! It's over!
As we can see here, we have like 10 different projects, and I feel very proud to be here and just looking at what we have done. And we did it so fast and so very good, I think. So it's, you know, it's amazing.
So I'm pretty sure that it will mean a lot to the patient in the long run. Short run, there are some low-hanging fruits we can pick already.
I think we need to come together more and more to add that sense of urgency and leverage what we have internally to get to that stage where we can really see a significant improvement in patients with cancer.
Okay, it's time for our first keynote speaker. So welcome on stage, Elena Bonfiglioli from Microsoft.
Thank you. Good morning. Good morning. It is a pleasure to be here. I want to share my warmest thanks to Sigma for bringing us all together here, for inviting me, but mostly for being such a great partner. And I say that really meaning it in terms of what we stand for as a company. What Sigma stands for, what Microsoft stands for. I think when you start partnership for a better tomorrow, when you think about the challenge of really transforming healthcare, you need to start from something that is fundamental. What you believe in as a company. What's your culture, and what is that you want to leave as a legacy. And that is where, you know, when we look at what we stand for is, I see it summarized here, is collaboration and intelligence with the patient at the center. That is where both our companies, together with others, want to really transform the experience and the outcomes that a patient can have. And that is fundamentally linked to listening to the unmet needs that will bring the innovation. The innovation race, what you saw here, was amazing, 52 hours, incredible excitement. I mean, the colleagues from Sigma and Microsoft were there, the colleagues from Health Innovation. It was amazing, but this is not one time in a year. This should be our daily mindset. What should we do every day, collaborating with others, rethinking new things? And how do we find the ideas for innovation? We actually find it by listening to patients, to health professionals. These are the heroes of healthcare. That's the way we call them in Microsoft, right? The heroes of healthcare is not the IT vendors that are there to actually enable others. Technology is an amazing transformative power, but it should be invisible. It should be seamless. And that is where I think we need to start rethinking the idea that technology is something that, is in the form of a computer or a screen or a phone, is moving farther back. We call it an invisible revolution, is moving farther back. And ideally, it powers the way in which we collaborate better, seamlessly, avoiding all of those errors that are human errors and are due to lack of the right information at the right time for the right process. It should be empowering the way in which we can take better decisions, because some of these decisions are automated. That's what we call intelligence. Systems of intelligence that allow healthcare professionals to have the right information to make decisions at the right time, that allow us as citizens, before we become patients, to have the information to take our own accountability, to take our own decisions for healthier lifestyles. When I think about the vision of Sweden in healthcare, in terms of being the best place, in terms of really leveraging their resources, the strengths that you have already, making people more independent, making systems in a way more resilient. That, I think, is the right vision, because it's really about empowering. And that is where Microsoft, as a company, we have it in our mission. When you look at our mission, empower every person and every organization in the world to achieve more. That is to achieve healthier outcomes, to achieve healthier experiences. That is the way we take that mission into one of the 6 prioritized industries in which Microsoft is really investing, and healthcare is one of them. And that's where we can partner with organizations like Sigma. There is also a sense of leaving something that is, of course, primarily, for a country like Sweden, but secondarily, not less important, where Sweden can lead the way to other countries, emerging markets. I'm very sympathetic with the fact that the founder of Sigma has a very strong footprint in terms of the contribution to the African continent with programs that are there to empower both education and healthcare. This is something that we share, and I think it is very important, because we cannot have pockets of excellence in healthcare in a lake of healthcare inequality. It is amazing. If I take a great example of, let me share this reflection, really. When I think about the work that you have done with the virtual care rooms here in Sweden, this is pioneering for Europe. Let's be very clear. But when I think about the fact that the way in which you empowered Annalisa to manage her own diabetes remotely, to really take that accountability, to understand what's happening, to feeling safe and secure. Imagine a mother in Africa that cannot get diagnosed for cervical cancer because she will not leave her 3 or 4 kids for a couple of days to walk to a clinic where she can see an expert doctor. That same virtual care room can make the difference. And we, from a micro standpoint, we are, for example, partnering in Africa to make that mother able to see an expert nurse by going to a school or to a community center where, through a teleconsultation, she can have an expert nurse look at the image and do the right diagnose. And when you hear a mother saying, I can live to see my children grow up, you understand that you've made a difference. And that is where I think Microsoft Sigma, all of you, can really take a very profound contribution to the transformation of healthcare where we live, where we're very fortunate to live, and elsewhere in terms of what we can share. So I think that kind of tells a little bit about what motivates us as a company, and also, surely, what I think can motivate all of us as agents of change. With that in the background, let me share a couple of considerations on the evolution of health systems, but also the evolution of health technologies. And when I look at the evolution of health systems, really at high level, at macro level, I really see these 4 things happening. First of all, if we are brave and courageous enough, then we transform towards a system of value-based healthcare. You saw the example of Uppsala. I mean, when I went there and I met a couple of the representatives there, they live and breathe, they have that aspiration, and I know that many of you have that. We need supporting policies, ambitions, and courage to transform our systems to make that happen. Care beyond walls, it is sure that Europeans, while not really clear about what is going to be our retirement plan, what we're going to retire with is 2 to 3 chronic conditions that we're going to have to manage. That is, something that we know for sure, and it's going to cost a lot of money to our systems. And it's something that we need to manage not in the hospital, but definitely in the living room. So what are the ways in which we get prepared for that? What are the ways in which care moves from being perfect within the wall of an hospital, but across the continuum of care, and we can follow that citizen, even before it becomes a patient, across all the different actors, organizations, stakeholders, chain of trust. If it is an elderly person, that person will have to be supported by many others. So actually, we care for our children, we work in a daily job, and we care for our elders. That is going to be what we're going to have to manage. And at the same time, together with that comes the consumerization of healthcare, where is it through gadgets and sensors? Is it even through, when you look at what's happening in life sciences, a lot of the big drugs, blockbusters, are going off patent, a lot of over-the-counter drugs, products that we think about like toothpaste, like it could be a consumer product. Actually, there's a lot of science more and more behind that to be sure that our dental health is costing less and less, and we do prevention even for the ingredients that we put in a toothpaste. So all of that is transforming the lifestyle and how we think about healthcare. And finally, precision medicine in terms of the revolution of understanding molecular biology and genomics and what it means to have a drug that works for you. There is not one type of cancer. There is many different variations, and how that treatment works for you could be very badly affecting somebody else and providing adverse reactions. So how do we understand that? And of course, to go through all of this, there are a couple of things that need to happen in technology to support in the background that transformation of health systems. That's what we call the evolution of technology systems or health solutions. One thing I always try to bring the attention on is the shift from systems of records to systems of engagement and insight. What do I mean by that? We have spent, over the last decade, a lot of money, a lot of attention, a lot of your time in making sure that we put a boost to electronic medical records. And oftentimes, some of the electronic medical records are thought of as tracking an episode of care at a point in time. So how do we evolve that to be a seamless experience from which we can manage from within that record, for example, care that happens in the community, beyond the walls of the hospital, across all the chain of stakeholders? How can I, without having to go through too many systems actually, place a Skype call or just interact with a video consultation with my patient for a checkup in between consultations? How do I make sure that as I chat with a friend, I can chat with the care team that is following this patient, maybe in another organization, because there is something that I need to do from within the same system so that we can make it easier from the health professional standpoint. This is an ambitious step. Told like this, maybe it seems like, well, is it really not possible? Is it so difficult? Yes, it is something that requires quite a bit of technology reengineering, quite a bit of cultural and process reengineering. I was quite excited when I saw that one of your Swedish electronic medical record providers, actually, Cambio, has really started this journey. Was it 18 months ago? And trying to really develop this way. We are at the beginning, but that is the way in which we need to evolve if we want collaboration and intelligence with the patient at the center and making it easier for health professionals. I hope that, that sketches somehow the future. At the baseline of all of this, from a technology standpoint, there is the vision of democratizing artificial intelligence. Democratizing it. And I insist on the verb because there is a lot of sometimes confusion and sometimes fear. What is this thing? What is this AI? What are these systems of intelligence? What are they going to do? Who is developing the systems? Who's training these systems? And when our CEO spoke at Davos almost a year ago now, he said, we need to make sure that artificial intelligence is not owned by a couple of very large companies, but put to the service of the users, put to the service of all developers, no matter on the platform on which they decide to develop, and it needs to be infused in all the technologies that people use. So as you can see here, infused in intelligent agents, infused into applications, infused into services, into infrastructure, so that you really get the best of the intelligent experience. You don't have to be confronted with the hurdles of what that really does and what it means. And when you think about what intelligence can do, there are a couple of things that I want to show you. But interesting enough, it means that if you think about cognitive services and how those cognitive services, is it understanding an image or understanding the context of an image, understanding the context of a sentence and how a doctor can dictate something and be put in the right context or extract information or, read amongst a multitude of information and create the right keywords to summarize knowledge. All of that, how can it be put to the service of healthcare? These are the examples that I want to give you. And these are some of the headlines that people read in the press. But what comes to life in terms of what artificial intelligence means when you see, for example, that the Microsoft software recognizes images better than humans do. What does it mean for a person that is blind? How do we use artificial intelligence to enhance human capabilities, not to replace them? Not to replace them. How do we allow health professionals to become better at what they do thanks to AI? Let's see.
I think it's a man jumping in the air doing a trick on a skateboard.
I teamed up with like-minded engineers to make an app which lets you know who and what is around you. It's based on top of the Microsoft Intelligence APIs, which makes it so much easier to make this kind of thing. The app runs on smartphones, but also on the Pivot Head smart glasses. When you're talking to a bigger group, sometimes you can talk and there's no response, and you think, is everyone listening really well, or are they half asleep? And you never know.
I see two faces, 40-year-old man with a beard looking surprised, 20-year-old woman looking happy.
The app can describe the general age and gender of the people around me and what their emotions are, which is incredible.
Isn't it amazing? Sometimes, even for non-visually impaired people, even for me, it would be great if we could read the sentiment of the crowd, saying, what are they thinking about? Are they looking surprised, interested? You know, how is this going? And actually, this is happening. So artificial intelligence is being trained to also understand the sentiment that we have. Are we stressed? Are we not? Or imagine, take very small children below the age of 3. They cannot express the amount of pain that they feel. So we are working with a leading pediatrician to train the system to understand from the type of movements that they do. I mean, little ones move all the time, but sometimes in a more stressful way. The way, how loud they scream, or the way in which they move their face, the level of pain, and then be able to take more informed decisions. So imagine what that can do, what it can give us in terms of putting that patient at the center, collaborating better, having better intelligence. For me, I mean, it's interesting because you try to summarize very complex things at the very end. If we're successful in that, which seems a very simple equation, then we can really make a difference. So let me bring you to a journey of examples of how artificial intelligence and collaboration come to reality in healthcare systems. And you can raise a hand when you have enough, okay? That's the deal. If not, I keep talking. So we spoke about how a computer can understand an image, can understand what's happening, but imagine the challenge of a neurologist that has to assess a patient with multiple sclerosis. And if you take, and this is proven, no matter the standardization and all the schemes that have been done, all the measurements, if you take 2 neurologists assessing the same patient, there is an element of human qualification that makes it so that they evaluate it differently. So they have used the ability of our Kinect technology to understand the movement in the skeleton of the body to the very, very, very most precise movement, so that they can assess the movements and the improvement of patients with multiple sclerosis and help neurologists better tailor the treatment that they can give them. This is applied to multiple sclerosis today, but it can be applied to many other type of neurological conditions. And when you look at the opportunities that this has for home-based virtual rehabilitation for elderly people, we have examples in Denmark of how mayors of cities are saying, you know, one therapist can only follow a certain amount of face-to-face rehabilitation with seniors. If we have a home-based system that can be in support and in parallel to the work of the therapist, we can see, number one, the quality of exercise. How many times do they do the exercise? I can get that information so that when I see the patient face to face, this can be a much different type of conversation, or I can call him up and say, why are you not doing your exercises? So it's about that continuous engagement, and the intelligence is in the background. This is an interesting statistics, because this is a projection in terms of how fast are we going to have this as a practice of reality of today. We do need to think about artificial intelligence and collaboration and virtual health technologies, not as something that we do sporadically or in the future. A better tomorrow is actually starting by the decisions that we do today. So I think that, it's interesting that more than 1 out of 2 of the providers globally will have a new way of clinical practice that integrates artificial intelligence components. Basically, if we do not get ready today, we are not going to get there by 2025. So we have tried to sketch out some of the scenarios, and for those of you that are interested, actually, if you go on the website, Democratizing Artificial Intelligence in Health, you can see what can be done with AI today, both in terms of where the research is going and in terms of partner solutions that are in the market today. This is very important, in the market today. This is not about promising benefits and getting quite a bit of money for AI projects that we're not sure on the return on investments. This is testing things, iterating, learning, and making sure that you can have value today. And we have also codified a little bit our approach in terms of how do we, Microsoft, work. First and foremost, around 3 main pillars. The fact that it needs to be infused in quite a bit of research. So there are investments that we've made with Microsoft Research in our labs around the world. 20 years, most particularly we have here in the UK, in Cambridge, a lab that has been specializing in artificial intelligence and in healthcare. So transferring that research capability into our own technology and in the way we go to market with partners, but also taking the element of trust and ethics very, very much to heart, so that we can start working with practitioners, with health professionals, with regional authorities, with national representatives on what are the ethical questions that we should look at together for AI, the ethical dimension of artificial intelligence. And we are actually having a project with the University of Oxford, a 3-year project on that ethics of AI, in which actually some Swedish representatives have been participating, notably from Karolinska, to share their questions and also to put forward the right pathway. Maybe, I put it out there as a big, bold goal, to think about a European framework for health data donation. Because think about it. We donate our blood, and we can even donate our organs. But today there is nothing that regulates if and how to donate health data. And if you ask a patient, will they want to have an asset of data donation to make sure that themselves or the people that they love will be better treated, they'll say yes. If you take rare disease patients, because of the small sample of that community, that is definitely a pressing need. And in some other cases, the same. And we cannot do that alone. So we were very pleased to have Sigma as one of the pioneers in the Artificial Intelligence in Health Alliance that we have launched a bit less than a year ago. This is something that is important. We need to bring our assets together. We need to work together. It's not one person that will solve this equation. And then if you allow me to go back to a couple of examples of how this comes real in clinical practice. Let's take diabetic retinopathy. So if you have a diabetic person, there is a higher likelihood of that person to develop blindness. And oftentimes, it's about tests that are not done at the right time, diagnosis that comes in too late. There is an AI solution that actually is now quite widespread in the US, and we're looking at where and how to also share some of those learnings with European organizations, where you can take an image of the back part of the retina and then send it up to the cloud, have it compared with a very wide database, sending back results, and doing that in any practice, so that citizens that know that they have a diabetic condition can prevent the settling in of diabetic retinopathy, which is a huge cost to the system, but also, of course, a very, very huge cost to the human experience. So that's a very simple situation in which we just bring in elements that we didn't have before. This is another example of how we have always worked with the diabetic community, actually, in making sure that in the cloud, one could actually read the elements of the glucose in the blood and then share it with the chain of trust, so that maybe the child could see it in his watch, maybe the parent could see it in the phone, maybe the caregiver can see it in its own app. Everybody could have a situation analysis and take the right decision. Again, something very simple, something very intuitive, but something that was not powered before without that fabric, invisible fabric of cloud computing and that intelligence in the background. This is an example of chronic kidney conditions. They come from my own country, from Italy, with a partner over there. And it is about how you take a biomarker that is already actually tested in our analysis, the creatinine, and how you put the right algorithm at population level to understand the likelihood of a person to go into dialysis. And if we can move that, forward, if we can anticipate and we can delay the entry of patients into dialysis, cost to the system, cost to human experience, again, being huge. I have a couple of minutes. 2, 3, 5-ish, okay. That's good, thank you. So I wanted to bring an example from a partner called Kensai here. It's interesting how at population level we need to get better to really stratify patients, understand the risks, and then have the right decisions. And this is not something that is new, is that having the right data, the right intelligence, and the infusion of that intelligence into applications that we use all the time. That is what has not been done before. That is, for example, something that I know Sigma and Cambio are looking at in some of the projects. And I think that's the right way forward. If you look at what they have done all around the world, this means that you can look at, if you take, a payer view, you can look at who are the cohorts of patients in a population that cost the most, and then target the right intervention. Instead of intervening on the whole population, target the right intervention, and therefore make more effective decisions and reduce cost. This is a case that we have from Asia, in Fullerton Health in Singapore, and this is something that was not done in years. This is something that in 2 months was set up and done. So that's really very interesting. And you see here, if you're interested, we can share some of the examples. There is many different various examples. Is it COPD? Is it diabetes? Is it access to emergency departments and efficacy in emergency departments? This is something that is becoming more and more in the reflection of ministries of health. In Portugal, for example, the minister was very clear. I want my citizens to have an app on their phone where if they're about to go to emergency department, they're going to see for a specific condition, what's the queue? in the various emergencies department where I can get to, so that I can make more informed decisions and I can use health resources better. It's a citizen service, right? It doesn't matter how much cloud computing, how much information and so on is in the background. It really transforms the experience when you need it. And I wanted to show you this and probably close on it, because at the end, we think about what AI can do for a system, what AI can do for clinical practice and so on. But if I now have a symptom and I want to respond now, how would that work? So let's see. Here it is. So I type on my phone, my leg hurts, right? I have something and I want an answer. And there is a bot talking to me. Now, beware. 1 out of 3 interactions, people are not sure if it is a bot or a person, right? So let's be very, very careful. But there are here certain things that the bot does. So first of all, there is a little diagram that helps me to locate that pain. When did it start? What's the context? Are you pregnant? Do you smoke? So color coding, very simple. You know, tell me how severe that is. What type of situation is that patient in? And then from there is a clinical triage. It follows a clinical protocol. And then from there, it redirects you to the best case. Is it to a nurse? Is it to a teleconsultation? Is it to an emergency department? Again, it's just making things most effective. That is the objective. And you could consider that when in the innovation race, actually, we thought about a coach bot. After you have had a head and neck cancer operation, there is an element of solitude, there is an element of emotional support that you need. Now, I'm not saying that a bot is the best support from that, but if it is that or nothing, and the first moment in which I can share what my situation is, I can get advice, I can get connected with others. Actually, here in Sweden, you have War on Cancer is a startup that we support and that works with us in the cloud to make sure that a community of care patients can really share their experiences. If you have, in support of that, beside the human sharing, also the bot that can coach you, that is fantastic. Imagine how much money we spend because we do not stick to drug treatments. So adherence is a very big cost. You say you go to a doctor, they give you the prescription, you take it, a little bit of time, and then you more or less, and then you forget and so on, and then you're not doing it right. Maybe that bot can send you a reminder. You know, maybe you can interact and see how things are going. There are new ways in which intelligence can come to our fingertips. It can help collaborate and definitely make things better. I had more examples, but I think my time is up, right? Can I share one more? One more. Okay, one more. Forget the slides. Sweden wants to be the best in the world, and I think you are on the way to it. I think you have some very good competition in the Nordics, and there is one experience that I've seen in Finland that I wanted to share, just maybe to inspire you. The Helsinki and Uusimaa region, HUS, has really taken an interesting approach, both in collaboration and intelligence. In the collaboration side and Care Beyond Walls, they said, what if we could serve our citizens from their living room? You know, imagine mental health, imagine childcare, maternal care, dermatology, all type of things. 12 practices already active, completely digital, where I can be a doctor and refer a citizen into a virtual health type of ticket so that it goes through the virtual hospital. They call it the health village because it's a set of practices, but a virtual process for the citizen to be treated with symptom navigators, information, teleconsultations, first and foremost from the living room. That's on the collaboration side. On the intelligence side, they have put the best of cloud computing, so the idea that the cloud can reason over a very large amount of data, into a vision of health-driven, the health data-driven ecosystem, where they have a lot of data that are digitized, including digital data from biobanks. They input that into the cloud, and they imagine services from precision medicine to more informed research to personal health services and so on that are basically the digital output, the intelligent output. This is the new services of tomorrow. We call it the reference example of the WHO's data lake, because the data lake is the technology that powers it. But what's important is that is a vision of digital data input processed in the cloud, who cares about that, with digital output, which is better services for health professionals and patients. And that, I think, is a very powerful vision for where we're going tomorrow, for a better tomorrow starting today. Thank you.